So I've been talking on the Brekkie Show this morning and telling you about this 10-year study that's been launched, which will investigate the long-term health effects of vaping on young people's health and well-being. The £62 million project funded by UK Research and Innovation will track 100,000 8 to 18-year-olds over a 10-year period. While vaping is less harmful than smoking and can be a useful tool to help adult smokers quit, youth vaping has skyrocketed in recent years, with a quarter of 11 to 15-year-olds having tried it. I mentioned yesterday, me and Mrs. D was having a cup of tea in Loch Lane. Two girls walked past vaping. They must have been about 10 or 11. Well, the research coincides with the world-leading tobacco and vapes bill, which will clamp down on flavours, packaging and displays deliberately designed to appeal to children. Well, Professor Ian Ashworth is Director of Population Health for NHS Cheshire and Merseyside, and I'm pleased to say joins me on the line now. Good morning, Professor Ashworth. Good morning.
Good morning there.
Yeah, thanks for joining us this morning. So do you welcome the announcement then of this 10-year study looking at the effects of vaping on young people's health, Professor?
Absolutely, really welcome it. It's something that our local NHS, who I work for, and our local directors of public health across the 9 areas in Cheshire and Merseyside have been advocating strongly about the impacts of vaping on our children and young people for the last 12 months. So the more information and intelligence that we can get about that long-term impact that we can share with our young people and adults, the better, really.
It's out there, we see it all of the time. We're surrounded by, we notice the increase in the number of young people trying out these vapes now. I'm just saying, I saw two girls walking past the coffee shop yesterday. They must have been about 10 or 11, Professor, on these vapes. Why do you think there has been this increase then with our young adults taking to vaping?
That's really frustrating, isn't it? So, last year, which I mentioned, was we were really advocating strongly about that. We saw an explosion in youth vaping, and a lot of that's been down to the appeal that's come from being able to be disposable vapes that thankfully will be single-use, be stopped later this year, and then the type of flavours that were being put forward. And we know from speaking with young people, there have been. That's the appeal that's gone into place. So we were advocating strongly around the new tobacco and vapes bill, about making sure there's better restrictions in that place that are advertising. So, for example, it is illegal for under 18s to be buying vapes or adults to be supplying them to them. But as you said, over a quarter of 11 to 15-year-olds have tried them. And we teamed up with our colleagues in Trading Standards in the Northwest. And in 2023, we saw 14% of young people have been vaping once a week, which jumped up from 6% in 2020. And so that's why actually getting the vapes bill through and getting more research in place will really, really draw attention to this issue, really. So, and we've all got a bit of a role to play in there. Obviously, vaping is a really useful tool for adults to help quit smoking, and we want to make sure that people can get their access to do that well. But if you don't smoke, you shouldn't vape, and we need to protect our children from that, really. I'll probably also say that children aren't just little adults. They've got developing lungs, they've got developing brains. We all know nicotine's a very addictive substance, and that mix with developing lungs and brains isn't a good one to do. And so we want to be able to give them some dependable, non-judgmental advice and support in that area to stop.
Yeah. Well, I guess looking at the bigger picture as well, Ian, the effects, the long-term health effects that vaping can have on our children. Can you highlight those for us? And as alarming as they may be, what are we looking at here long-term?
Well, that's the thing. So to put it simply, from the reason this research is getting done is to try and draw those out, because there hasn't been enough research to understand what those long-term impacts are. It's very unlikely it's going to be very positive, or it's going to be without risk. We know from the short-term impacts, for example, that it brings about coughing, headaches, sore throats, the nicotine dependence. And we've also heard from our asthma and lung UK colleagues about the inflammation it can cause in the airways, particularly if you do have asthma or other respiratory issues as well. So those impacts over a prolonged period aren't going to be good for children and young people in development. That's why we're really clear about absolutely stopping that access to vaping in our children and young people supporting them if they have had access to that. But smoking still is the leading cause of preventable death in our area, and we want to end smoking everywhere for everyone. So we want to make sure that adults, if they are wanting to use vaping, can get that. And I would just say, if anyone is listening, there is an opportunity there to go on the NHS Better Health website and get local support from your services. There's each of our areas, there's local community stop smoking support services, and take that offer up.
Yeah, I mean, the offer of any kind of support will be greatly welcomed, I'm sure. And I'm sure there's lots of parents, carers or guardians who are frustrated, with their young adults, that maybe, their niece, their nephew, their son or their daughter who are struggling. I'm guessing, a lot of kids probably do it because they think it's cool and all their other friends are doing it. And then there's the peer pressure and all of that. Just quickly then, Ian, how important is education in helping young people have healthier lifestyles and futures? And should there be a curriculum on addiction in schools now?
Well, so education's massive for us. So one of the other reasons why we were quite exercised around all of this is we're hearing from our head teachers and education community about the impacts vaping will have in their learning environment, having to confiscate vapes and the issues that they can cause. It can also, add to anxiety and nerves within the educational program. So we were wanting to try and work with that and raise and try and prevent that access to that. One of the things that we've done actually is working with our fantastic colleagues at Alder Hayes, established one of the first sort of vaping clinics in the UK. To try and see how we can support children and young people in a better place and that learning rather than waiting, because we can see that issue locally. So we're working with our colleagues there, and they've said that children and young people are actively seeking that support in how to stop vaping because they have been able to get access to it. I would also say if you do come across establishments that are illegally selling vapes or and that there is an opportunity to go through the Citizens Advice Bureau and link into local trading standards around that, because we all have a role to play in ending that access and ending smoking everywhere.
No, I think you're right. I think it's a combination, isn't it? If we all work together, parents, the shopkeepers, the supermarkets, the government, more stringent rules and legislation put in place collectively together. And, the end goal obviously is to have a smoke-free generation and to live longer lives, obviously. Ian, just run out of time there, but really lovely to talk to you, and thank you for giving us an insight into all of that. Really appreciate it. Thank you.